takes. As you see, we could have a treatment plan that is not adequate. We could have loss of anchorage, and we could have movements that are inconsistent with treatment goals. So we will focus mostly with these things, but I will spend some time also for treatment plan and loss of anchorage, but not so much. I'm always pushing the wrong button here. The treatment plan. Well, I've been trained when I was young by Professor Melson, that you will listen tomorrow, to have a very clear goal in our treatment. So we have to set a goal for many things: mandible position, anterior teeth position, the arch shape and dimension. So we should see that and decide which are the, for example, the intermolar, interpremolar transversal dimension. The symmetry, we just usually trace a symmetry axis in our arches. And then these things that you see here are a consequence. So, okay, after that we have said this. Now the dental size, that means whether we are going to do extractions or doing an IPR, sometime we are increasing the size of the teeth or putting crowns, is a consequence. Whenever people start with the treatment plan by saying, oh, this is a 4 extraction case, for me, it's a rather limited way of seeing the things, because you should start by these points, and this is a consequence. And even later, you start thinking to the appliance. This is the real final step. Now, if I look at what people are thinking most of the time, I'm really appalled. I mean, I'm really confused by saying this. People post these things and ask to their colleagues, doctor, what would you suggest to me? And people just start, writing the most obvious things, but not really thinking to a treatment plan. They just say, okay, I would place this kind of appliance. They're just focusing immediately on the appliance, and this is not what we should do. Or they could even say, okay, go to the book there and there is a solution. So this is a very limited way of thinking to a treatment plan to me. You see, use a power chain to move the canine left. 2, 3, 4 power chain, and use little bit wide open bands. I don't know even what they mean, but what is important is that they are focusing on the appliance and not to the goal of the treatment. You see, it's all the same. I mean, I took this case, and people were just giving their ideas about the treatment, but it's not a real treatment plan. It's not setting a goal. It's just saying, okay, I would do that. Why not that other? I mean, it's very, there's aligners. That's my treatment plan, aligners. Okay, that's not a treatment plan. That's a word. Okay, so I'll tell you what I do and see we do in our school for setting a treatment plan. I'm using mostly the concept of the occlusogram, for which we have a software. And as you see, the things that I've told you before are here. So we set the position of the anterior teeth here. So we decide that we would like to reduce the overjet and overbite by doing this movement of the upper teeth and doing the intrusion of the lower. So it's a very clear goal for this teeth. Then we have the dimension of the arch and the shape, which we can draw it and make it different. So here there is a very small expansion in premolar area, while molars are almost with no expansion. We trace the symmetry axis, which is this line here. And I was doing this many years ago. And many years ago, I mean, I was attending Professor Melson's school in Denmark in 1989. So I had all dark hair and many more of this, and it was a little bit slimmer. So this kind of things that happen. So we were doing this manually, but the idea was setting a goal and drawing the same things that today we're doing with the computer and digital models. So this was a case that, you know, it happened to me a few months ago that I cleaned up a basement in my house, and I found, you know, a folder with this kind of things that was very old, you know, archaeological things. And so I just took pictures of this, and I said, oh, I was doing that when it was 1992, 1994. And that's the same idea that I'm using now. Now things are much better. You do it quicker. You have other tools to help you. But the concept, the basic concept, was still there 25 years ago. So we were setting the treatment goal. We were deciding the arch shape. We were having a symmetry axis. Maybe you see it here. And these arrows here are the dental movement that we were planning. And this was a case that was treated many years ago. You see, there was an analogic picture. It was, at the end of the treatment was in 95. It's mirror, so this is 95. And the case was treated from 92 to 94, so this picture was taken just after. And now we do the same things, but with much more powerful tools. It's okay. I mean, we are evolving and we're getting better, but still keeping the same principles. So this is the same idea for a complex case treated a few years ago. So it's